Hello everyone, my name is Jasmine Rocha. Today I'm going to be talking about genetical editing, gene editing. I chose this topic because right off the bat, the words gene editing got my attention. I'm like, what's that? What's genetical editing? Like at first my anticipation of it was gene editing, like are we going to be editing hereditary genetics from our parents and making our own like custom baby, something like that. But that wasn't the case at all. It was about Victoria Gray, who was sadly diagnosed with the disease, sickle cell disease, when she was just 3 months old. 3 months old. She doesn't even know what the world is yet, and she was 3 months old when her grandma knew when she was taking Victoria a bath. She knew that something was wrong because she just kept on crying out of pain, like if she was dying or something. So her first response was to just take her to the hospital. So they took Victoria to the hospital, and the doctor ended up saying, your granddaughter has sickle cell disease, which is a disease that doesn't let cells, like blood cells, really go through the bloodstream like how regular blood cells do. Instead, it deforms into different cells, and it causes a really sharp pain in your chest area. Victoria says that she would get these sharp pains out of nowhere, and it really affected her life. Her whole life she was known as the sick kid. Nobody wants to be known as the sick kid, especially being young age and everybody else just trying to figure out who they are, not trying to be judged, etc. So when she found out about this, it really stunned her, it really shocked her, startled her. Nobody wants to find out that they have a disease at such a young age. As Victoria got older, she kind of just gave up. She was like, I don't know what to do, like, so she was hopeless until she ran into a doctor, and the doctor had told her, we have this like experiment basically where we inject millions and millions of cells into your body, and we try to dissolve the cells that you have, but this has never been done before, so are you willing to take the risk? Victoria was 100% okay with the procedure. She said that it was really painful at first, but it started to work. The doctors didn't want to get all hopeful and happy and comfortable with the results yet, because we never know what can happen, and it's a test in progress. So they created this so that people with these issues were able to dissolve them, were able to help them with the pain, not strictly have the issue away 100% gone, but to help them with the pain and the issue. And that's what happened with Victoria. She had been away in the hospital for some time, and she had left her husband, her family. Imagine leaving your family and being stuck in a hospital trying to figure out what you can do with your body that you can't control. What is one interesting, surprising idea you learned from this podcast? Why do you feel it's interesting, surprising? I think it's interesting and surprising how our bodies can respond to anything. What I mean by this is that the cells that were produced in the body for Victoria, she was able to take them in, and she was able to be better with them. What's something you think about differently after having listening to this? What I see differently is that medical research is improving. They obviously have found something for the sickle cell disease, which helped Victoria in her case, helped her improve not only in health-wise, but mentally as well. What is one question you still have after listening? My one question that I have is, why isn't the media knowing more about this? It is such a health issue. Over 100,000 Americans go through this every year or have sickle cell disease. Why isn't it spread out? And I understand that there's still a lot of research that has to be done and tests, since Victoria was the very first one to go through it, but it should have been more explicit and more out there. How can the information present in the video be helpful to your future career? It'll be helpful to my future career, which is psychology, because it will help me with my clients, or patients as you could say, who have probably had medical issues, and I know a little data about a disease that maybe one of my future clients will have, and we can evaluate and talk about the whole issue itself and then go from there. And I feel like overall it's something important that a lot of people need to know about. But yeah, thank you.